To talk about a question from CK2. A 62-year-old woman comes to the physician because of 3-day history of rash on her face and hands that she not improved with the use of skin moisturizers, antibiotic ointments, or corticosteroid cream. She has a 1-month history of progressive weakness. She has difficulty rising from the chair and reaching over her head. She has not had any pain. Vital signs are within the normal limits. A photography of the hand is shown. Muscle strength is 3 out of 5 in the proximal upper and lower extremities. Which of the following is most likely diagnosis? So it's a question taken from CK2 and the topic is the rheumatology. And by seeing the image you can also get some idea that this question has taken from rheumatology. Now, if you have studied, then you should be familiar with these purplish, or we can say violaceous, or we can say reddish papules over the joint on the dorsal surface of the hand, especially or the metacarpophalangeal joint or interphalangeal joints. So these are called as the Gauthran papules. So the Gauthran papules are specific for one of the disease given here. If you are not familiar with the finding given in the image, then you can take some point from the question itself that there is a progressive weakness, especially muscle weakness that can cause difficulty in rising from the chair and reaching over the head. And they also said that the muscle strength is reduced, especially in the upper and the lower extremities. So this question wants to ask a problem of muscle. There is no lab diagnosis is given or lab finding is given. So all these diseases has some relation with muscle weakness, but one of this is more related to the finding given in the image and the question itself. So from E, if you talk about the scleroderma, this is also a disease of connective tissue, but in this case usually you can find tightening of the skin, difficulty in swallowing, dysphagia, there will be hypercalcemia, and because of tightening of the skin the fingers appear somewhat like bandit, but then there will be no rashes over the dorsal surface. In case of SLE, examiners usually give female with butterfly rashes. Butterfly rashes, especially at the face, sparing the nasolabial region, which is not given in the question. Psoriasis has scaly lesions over the surface or of the skin, scaly pruritic rashes, which is not given in the question. If you talk about the myasthenia gravis, it's a neuromuscular disorder where antibodies attack and block the acetylcholine receptors. So in this condition, if the examiner wants to ask, he will give some muscular weakness, especially ptosis at the end of the day, and there will be decremental response of the muscle. It's mean a patient can perform some physical activity at the morning time, and the strength of the muscle gradually become weaker and weaker at the end of the day. It's mean decremental response, but here there is no history given like that. So the answer is dermatomyositis, because Gauthran papules are given here along with muscle weakness. If you want further confirmation, go for the lab where you can find increasing creatine kinase level. So this was the question of today's. Thank you.